Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, over 1.2 million doses of COVID-19 vaccines have been administered in the country. And as the government targets to inoculate up to 50 to 70 million Filipinos this year, what challenges confront local officials? Also, netizens react on the fresh batch of, or quote, second dose of crushed dolomite being dumped along the Manila Baywalk. Manila Mayor Isko Moreno joins us live. The government has administered over 1.2 million vaccines nationwide. That's according to data as of April 13. About 1 million people have gotten their first shot, while 162,000 have received both doses. Manila, last we saw, tops the list of most vaccinated people. Let's go straight to the source of the story. We have Manila Mayor Isko Moreno. Yorme, magandang umaga po sa inyo and thank you for your time.
Hi Pinky, good morning sa iyo at sa mga staff natin dyan sa CNN at yung mga manonood. Good morning.
Nakita ko po kasi yung National COVID-19 Vaccination Dashboard, and at that time, I saw that Manila vaccinated so far about 68,000 doses. Ito pa rin po ba yung update?
Opo, salamat sa Diyos na nagkaroon kami ng bakuna at ito naman dineploy namin agad. As you all know, we've been preparing for this since last quarter of 2020 and we implemented it through a simulation program last January. Then, noong dumating nung March 1, yung bakuna, it was deployed first in Manila through national government. Then, the day after that, we deploy our own vaccine, yung binigay sa amin ng national government. And today, as we speak, we have vaccinated A1.1 to A1.7, A2 and A3, 72,000 plus ang nabakunahan na namin. So, almost 72,000.
So sino po sila? We're talking about who? Mahirap po minsan kasi intindihin yung A1.1 to A1.7. So you have healthcare workers, you have senior citizens.
Yung A1, nag-evolve siya. No? Yung A1 is medical frontliners. Ito yung mga doktor natin at nurses na involved directly sa pagmamanage ng COVID patient. Tapos nagkaroon ng 0.2, 0.3, 0.4. Ito naman yung mga tao nasa medical frontline pero hindi sila direct but they are in the institution. That merong kumbaga hot zone, no? Pinky. Then yung A2 naman, yun yung mga senior citizen. We started AstraZeneca for them for 2 weeks. Then nag-evolve yung policy through the directive of FDA na yung Sinovac pwede na sa senior citizen. So nagbakuna rin kami ng senior citizen na Sinovac ang gamit. Then na-achieve namin yung minimum numbers, nag-progress. No? Napunta kami sa A3. Sa A3 naman, ito naman yung 18 to 59 years old at ang gamit ay Sinovac. Sila yung mga may comorbidities. And salamat sa Diyos, maraming nagpapabakuna. Kami baliktad na ngayon na nangyayari, Pinky. Oo, yung tao na ang dumadagsa. No? At talagang dati parang ang hirap magkumbinsi ng tao Yun yung mga challenges namin nung una, no?
Yeah.
Nung sisimulate kami, naalala mo yung first week of January, nagsisimulate kami. Talagang parang ang survey nun, halos wala kang makuwang gusto magpabakuna. But we're very happy and thankful to the people of Manila na nag-adapt sila sa sitwasyon. Kaya ngayon, talagang we're hoping that the availability of vaccines is there kasi maganda yung momentum. Dahil pumupunta talaga ang tao ngayon.
Okay, so that's good news. But so far, it's healthcare workers, senior citizens, and yun pong mga hindi seniors with comorbidities. Question, sir, yung mga healthcare workers ba, does that mean all the healthcare workers in Manila have been vaccinated?
Well, based on our suggested list, fully compliant kami, no? We submitted 6,567 yung nakatala sa amin sa lokal. At ang nabakunahan namin under that is 13,000 plus. So, ang ibig sabihin, after namin mabakunahan yung amin, at malamang hindi yun 100% na nagpabakuna yung 6,567, no? Nag-offer kami ng bakuna sa mga doktor sa national government, hospital, at private hospital. So any John Doe's and Mary na nasa medical frontline fall under A1.1 and A1.7, niyakap na namin. Kaya umabot kami ng 13,000 plus. Kaya kami na-elevate to A2.
Okay. So,
pero meron pa rin mga hindi iilan na mga medical frontliners na hindi pa nababakunahan hanggang ngayon. It doesn't mean dahil ayaw namin silang bakunahan, but o hindi sila na-reach. No? Meron lang sila mga preferred brand na hindi pa available.
Okay. So far, 72,000. Nag-umpisa na ho ba kayo sa second dose of these individuals, of any individual actually?
That's a very good question. No? When we inoculated the March 2 with Sinovac to A1, yes, we did. 2,654 na ang na-second dose natin out of the 72,000 vaccinated yesterday. And as we speak, Pinky, there is an ongoing vaccination. Wala na kaming vaccination ngayon dahil wala na kaming bakuna. But there is a vaccination today for second dose of those people got vaccinated last March 2 to 18. No?
I see.
Oo, kaya second dose sila ngayon. So most likely, we have a target of 1,280 people who should, based on our data under www Manila COVID-19 vaccine.ph. Yun yung target today na dapat pumunta.
Pero doon sa mga iplano yung second dose na vaccine, sorry, I got confused with the numbers already. You are hoping to vaccinate how many, Yormes? 2,000 plus ba?
At 1,280 ang inaasahan namin na dapat na pupunta today for their second dose because noong mga panahon na yun, may 1,280 na nagpa-first dose.
Okay, but so that's from the period...
Ang nabakunahan natin is 2,654 na second dose.
Okay, all right. So meron pa po kayong bakuna. I guess that's the most important question. Para doon sa mga nag-first dose from March 2 to March 18, kumpleto pa po ba yun?
That's a very good point, no, Pinky. When we get our vaccine, from day one, nag-isip na kami kagad because of the scarcity of production of the vaccine, no? Nung una, kahit wala pa yung policy, inisip namin, itabi namin yung kalahati. For example, nabigyan kami ng 1,000, tinabi namin yung 500. So, ang babakunahan lang namin 500. That is with regard to Sinovac. we still have the second dose. In the case of AstraZeneca, sinabi sa amin ng DOH, i-roll out lahat, including the second dose. So ni-roll out namin yung pati second dose simply because ang AstraZeneca, at least it may take 12 weeks for your second dose.
Opo,
Unlike with
3 months.
Sinovac, that is only 4 weeks or 28 days.
Opo.
Kaya mas
Opo.
mabilis ang balik, ang ikot ng Sinovac.
Correct.
And compared to AstraZeneca, that will take about 3 months for your, at least for your second dose. By that
Okay,
time,
so
darating.
Okay, so that's the next question. Kailan nyo ho inaasahan yung pagdating ng mga procured AstraZeneca vaccines of the City of Manila?
Okay. Two procurement tayo, no? Ang inaasahan natin, Pinky. The one, yung basic, which is yung binili ng national government through IITF, no? Kay Secretary Galvez. So meron silang binili at lahat ng ginagamit namin ngayon na bakuna ay galing sa national government. Yung binili nila, inaasahan na dumating ng Mayo at Hunyo. Okay. Now, going back to ours, no, kaming mga mayor, about 200 plus of us in the Philippines na bumili ng AstraZeneca, yung sa amin September. In the case of City of Manila, we bought 800,000 doses. That is for 400,000 people.
Opo. So, kayo ho ba, are you having second thoughts because of, well, you procured 800,000 vaccines of AstraZeneca at meron pong, of course, the reports that in some countries this has been suspended. Will this affect your procured AstraZeneca vaccines?
I don't think so until FDA made an announcement. Kasi for the meantime, wala naman sinasabi ang FDA. I mean, generally, yes, there are incidents and including Pfizer, AstraZeneca, Sinovac, all vaccine has some story to tell. But generally, tuloy-tuloy naman, no, sa buong mundo. And even including the Philippines. So wala pa namang abiso sa amin ang FDA.
So to be clear, you have stopped vaccination. Sara na po ang inyong vaccination for the first dose because you right now, what you're doing is for the second dose. Wala na pong pwedeng mabigyan ng unang bakuna.
Okay, maganda yung observation mo, no? Nagbabakuna kami ngayon, today and the coming days, for our second dose. But we cannot utilize those second dose para sa first dose. So madaling salita, wala nang bakunahan muna dahil wala nang bakuna. So until we were advised to do other things. For
Unless
now, wala
siguro
kaming
mabigyan
hawak na
kayo.
Pero
Unless
meron kaming
mabigyan kayo ng
darating,
fresh batch.
meron kami isang darating, no? They call it Gamaleya. Okay. With regard to Gamaleya, I think there is 20,000 arrive in the country. And we will participate in the training. Inintay lang namin, I think 2,000 vials ang darating sa amin. No? Training ng aming sa Manila Health Department. Kasi medyo challenging yung Gamaleya in terms of handling saka yung second dose. Kailangan pa namin malaman yun, matutunan. Unlike with AstraZeneca and Sinovac, no, you can get vaccinated anywhere in Manila for your second dose. Because we have a system. We build our own website or pre-registration system. Pwede kang magpaturo kahit saan, kung saan namin may bakunahan, kahit second dose kasi it's the same product.
Right.
Yung ginagamit. In terms of yung design, yung laman, at yung content, pareho. With Gamaleya, we've heard na magkaiba yung dalawang bote. Kaya ano kami ngayon magte-training through DOH, of course.
So, I'd like to talk about the hospital utilization in Manila. Gayon din po yung ayuda for your constituents, Mayor. But we need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. Our guest today, Manila Mayor Isko Moreno. Mayor, ilan hubang ospital meron kayo sa Manila at kamusta ang occupancy rate?
We have 6 local government-owned operated hospital. We have 972 bed capacity in terms of hospital beds in the city. And today, we already follow the guidelines, the new rules or guidelines na maggawa ng 50% COVID bed capacity sa aming mga ospital. Kaya we created 523, more than 50% kami, no? 523 COVID bed. Out of 523 COVID bed, no? 75% na kami. Malapit na kami. Red flag
Yun
na
yung
kami,
dagdag na.
Pinky. Medyo
Mayor,
scary yun, no?
Opo, ganito po, Yorme, kasi even...
Because
Opo.
sa private hospital, marami ng talagang punong-puno. No? With regard to another sets of individual, particularly yung COVID-infected individual, which is asymptomatic, they are placed in our quarantine facility. And we built last year about 570 bed capacity, and it became 800 this year, and we are now at 45%, no? 43% to be exact, bed occupancy rate ng aming quarantine facility. Now,
So meron pa
going
kayong
back
over
to,
400? Sir, meron pa
our
kayong over
COVID
400?
bed capacity sa hospital, medyo mataas to. Nasa ano na kami, medyo red flag to para sa amin.
Yorme, sa mga nagtatanong, saang ospital sila pwede pumunta kung meron po silang COVID-19 patient or loved one na positive? If they were to ask you now, which hospital can they still go to in the city of Manila?
Depende sa sitwasyon mo, Pinky.
Lagay na po natin sa
tayo ngayon,
critical.
no? Maganda yung tanong nung tao, no, nung nagtanong sa'yo. But ito maganda, if I may share this new strategy that we are trying to do to utilize machineries, equipments. No? If, halimbawa muna, asymptomatic ka, 2 things that you can do if you're asymptomatic. If you have a space, no? If you have a space in your house, stay there as much as possible. Isolate yourself. Just behave, like literally behave. Na kung wala ka namang space at natatakot kang ma-infect mo yung mga mahal mo sa buhay, dadali ka namin sa quarantine facility namin. We would love to welcome you and take care of you there. We'll give you ample medical care. Now, if halimbawa naman mild and moderate ka, mild and moderate, ibig sabihin may konti ka nararamdaman but you're okay, you can still stay home or go to our quarantine facility. No? Don't go straight to the hospital. Kasi chances are mapupunta ka sa triads. Mapupunta ka sa parking lot. Lalo na kung sa private ka, no? You'll be in the list, not naman list, but siyempre, pag ina-assist ng doktor yung pasyente, ang unang i-accommodate, of course, needs to be given proper care, no? Is yung severe and critical. Kasi ang ginagawa namin ngayon, pinaprioritize ngayon na punuin, palakasin yung ICU. Despite na yung ICU is a very challenging space, no? Kasi you need people na pulmonologists, you need the infectious doctors,
disease expert,
nurses. So medyo yun yung challenge. But at the same time, you need equipment to create ICU. Kaya yung utilization ng severe critical medyo mataas kasi limited yung space for that. So we have space, katulad niya, 75%, no? It seems, meron pa pala kayo. Bakit natanggihan ito? Kasi hindi naman siya tinanggihan. Dahil masama yung sitwasyon niya, yung available space is para lang kay mild and moderate kasi walang equipo yun. Ang kailangan lang naman niya, medication or regular doctor to address him or her. So, ililipat siya sa posibleng isang ospital na may bakante pa dahil doon sa sitwasyon niya. So, that's how we utilize now our resources to make it more efficient because what we want is not, there is infection, pero wag magkaroon ng kamatayan. Yes. And the best way maiwasan yung kamatayan is to give proper. Kasi dati ang goal namin, ample medical care. Yung tama lang. Pero may mga makinang kailangan na nakakatulong para properly ma-diagnose siya, properly mabigyan siya ng mga tamang gamot na makakatulong. Like in the case of Remdesivir, Abigan, and sorry to say, nahirapan ako doon sa isang brand Tocilizumab or club or something na napakahirap hanapin. So yun yung mga pwedeng ibigay sa iyo and all other things. No? That's how we are doing it right now. Then,
I don't have a lot of time, no, because we need to discuss other issues. Pero ang tanong ko lang po is this, sa mga possible critical patients, ano pa pong ospital sa Manila ang libre?
May mga pailan-ilan pa kami. May mga 2, 3, isa sa mga ospital na 6 namin.
Which
Marami lang
hospitals are
kami
these?
COVID beds sa ospital. Siguro about at least 40-50 available.
But which hospitals? Are all 6 hospitals, do they still have ICU beds?
Yung Santa Ana, yung ospital ng Maynila, yung Gat Andres, but it's not a perfect ICU yet. Kasi ngayon ang ginagawa namin, bumibili kami ngayon ng mga maraming makina. Like dinadagdagan namin, nagre-redirect kami ng bagong approach. And at the same manner, we are going to build, hopefully, may awa ang Diyos, we are going to build about 400, hopefully in the next 2-3 months, 400 bed hospital setting na COVID bed for mild and moderate to unclog our hospital, to create more ICU setting in our hospital.
We need to take another short break, Yorme, but we'll discuss yung pong ayuda at yung bagong dolomite, yung nalagyan na naman po ng pagtatambak ng dolomite sa Manila Bay. We'll be taking a very short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Manila Mayor Isko Moreno. So dun po sa ayuda, what I saw last, 116,033 families na po ang nabigyan so far. Yorme, when do you plan? Ano pong deadline nyo para mabigyan lahat ng iyong constituents dyan? And could I ask for a very short answer, sir, kasi mag-overtime na po tayo.
Sorry. 380,000 ang listed sa amin. And we were given 1.5 billion, 23,270,000. No? At in 8 days operation, as of now, 130,074. We are now about 35% in 8 days operation. We do morning, evening, afternoon operation, including Saturday, Sunday. So at the rate we're going at 35% in 8 days, then let's just add up another 8 days, and that's 70%, and another 8 days. So more or less within 21, 25 days tapos kami.
Okay. At yung pong dolomite, because this has been a hot issue again dahil nagkaroon na naman ng pagtatambak doon sa Manila Bay. Were you informed of this?
No.
And what are your
Itong
thoughts on
pagdampak
that?
ngayon. But we are informed about the project. Don't get me wrong. But more than anything else, while they're doing their thing in the national government, and while we're very grateful at gumaganda yung Roas Boulevard for that, I'm focused on what we can do about the pandemic. And yung kaninang technical, yung mga pinag-usapan nating nitty-gritty kanina. So I'm into it as of this moment.
But do you agree that it should have been done? This was done a couple of days ago, considering that there's a number of other problems that government is facing. Yung pong timing ng pagtatambak ng dolomite, do you agree?
Well, life must go on. Things must move on the way we wanted it. O sige, binibigyan nyo kami ng proteksyon, pero gusto rin namin ng trabaho. So we must continue to move on. And the country must move because economically we're hurt. At the same manner, the same rule should be applied. All other things in the government, in terms of visions, aspirations, future development for midterm and long term, must be done.
Okay.
Simultaneously, while we are approaching and fighting against pandemic, we cannot stop. If I'm going to decide on some things, etong left side, ituloy nyo lahat yan. Tapos itong right side natin, let's focus all our effort sa paglaban sa pandemya.
So malinaw, Yorme, you don't see anything wrong doon sa pag-rehabilitate o pagtambak ulit ng dolomite, just to be clear on this.
Yes, because the scientists, Department of Environment and Natural Resources said it is not harmful to the environment. So sa amin, we agree with that.
Maraming salamat po sa inyong oras, Manila Mayor Isko Moreno. Yorme, take care of yourself.
Ay, thank you, Pinkit. Mag-iingat kayo at sa mga staff nyo at mga manonood. Kapit lang, may awa ang Diyos, makakaraos din tayo. Thank you.
Thank you, and thank you for watching and joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.